Hello everyone, my name is Leonardo Eloya, and today I'm going to go over a series of flexibility and mobility assessments that you could do in your own home, in the comfort of in your own home, to basically identify if you have any limitations, in those muscles all over your body. I'm also going to include a few corrective exercises for each of them in order to attack those limitations and fix them. Okay, so to start off, you're gonna need a bench, or maybe you could do this in the bed. We're gonna test the rectus femoris and the hip flexor, so the iliopsoas. You're gonna lay down. So I'm using a bench. You're going to raise both knees. You're gonna flex the untested leg all the way to your chest as much as you can, and then you're gonna let the tested leg fall as much as you can. If the hip remains, if the hip falls below parallel, then that means you pass the test. If the hip, for example, mine stays above slightly 0 degrees, so that means I have tight iliopsoas. But if you want to cancel out the rectus femoris, there's another way that you can do this. You can start with your knee extended, and therefore, since the rectus femoris is shortened, the only thing that will be stretched is the psoas. So therefore, you let it fall, and therefore you see that my hip still falls above zero. So I have a tight iliopsoas. Therefore, if you want to test the rectus femoris, let the knee fall. If the knee has a lag of, so basically, if the knee has less than 90 degrees of range of motion, then you have tight rectus. As you can see, mine is very little, therefore I do have a tight rectus. And then by flexing it, you can see my hip goes up. So I have both tight rectus and psoas. Um, One thing that patients do a lot, they tend to do an anterior pelvic tilt, and this kind of causes the hip to slightly go more down. So as you can see, if I'm doing this anterior pelvic tilt, I'm getting a passing score, but it's basically false. So you want to make sure you want to keep a neutral spine in order to get some accurate results. Um, and of course, the femur and the pelvis have to do this as well. Um, so basically, this could imply that if you have any tight hip flexor or rectus, you might have difficulty performing a squat or maybe doing a an exercise that involves with the with the hip extension movement. Um, so a corrective exercise or stretch that you could do is you can go into a half kneeling position, and you're gonna lean your body forward and get that stretch right there in the psoas. And you're gonna hold that for about 30 seconds, and then you're gonna come back. And if you want, you could switch sides, switch sides, and then lean forward. You should feel that stretch, and hold for about 20 to 30 seconds, and come back. And you should repeat that for about 2 to 3 sets. Okay. Okay, guys, for the next assessment, we're going to be measuring the hamstrings, so the distal hamstrings and the proximal hamstrings. For the first one, we're going to measure the distal, which consists of the semitendinosus, semimembranosus, and the biceps femoris. Um, and of course, it's going to be, along the tibia, femur, and pelvis. So for this first one, you want to lay down flat. You could use a bed, you could use a floor, but just make sure that it's nice and sturdy. And this is very simple. You're going to maintain a fully extended knee, and all you want to do is raise your hip as much as you can. So basically, you get a passing score by getting 80 or above degrees of hip flexion. Sometimes, what patients might do when they reach their limit, they might flex their knee slightly and therefore get more hip flexion, but that's a false result. And so in that case, you want to make sure that their knee is always as straight as you can, and then lift up as much as you can. Okay. So as a corrective exercise, what you could do um, to basically target those distal hamstrings, you could do a what we like to call Frankenstein walks, and you should feel the stretch right there in the distal walk, in the distal hamstrings. So what you're basically gonna do is walk, but you're basically gonna kick out your leg in front of you like this, and when you kick it out, you want to make sure that your knee is as extended as possible. Okay, and that's what you're gonna do. You're gonna walk like that. Okay. And for the second flexibility assessment of the hamstrings or glutes, so we're going to target the glutes, the proximal hamstrings. So you're going to lay down again flat. I'm using a bench for this. You're going to want to have your hips at 90 degrees of flexion, and you want your base, and you want to have a neutral spine. You don't want to have your butt to come off like this, or an excessive posterior pelvic tilt. You don't want that. You want that those 90 degrees. And what you're gonna do is basically just extend your knee as much as you can without the hip swaying away. So the hip needs to be at 90 degrees, and as soon as you feel pull, you stop. So if you get a lag more than 20 degrees of knee flexion, then you failed. In this case, if I extend it more, you see how my hip extends. So a lot of patients might do that in order to extend their knee, but you don't want to do that. You want to maintain it at 90 degrees and and extend it as much as you can. Okay? So the corrective exercise for this, we're going to perform an RDL. So your knees, your tibias are going to be perpendicular to the ground, and all you're going to do is hinge your pelvic back, have a neutral spine, and basically think of rolling your hands down to your knees like that. Okay? So what you can do, you can hold this position for about 20 to 30 seconds, and when you're done, come back up, and then do it again 2 more times. So 1, 2, 3, all the way up to 30 seconds, and then come back up. So a lot of patients might do an anterior pelvic tilt, or maybe lean their body forward like that. So you don't want to do that. No, you want to maintain a neutral spine and just hinge your butt all the way back, and then slide your arms through, and you should feel it right above you. Okay. So basically, these flexibility these flexibility assessments for the hamstrings, they basically imply that a patient might have difficulty performing the same RDL or maybe doing a back squat, which could really lead to injuries, which is bad. So for the next test, we're gonna do a shoulder mobility assessment. It's gonna be called the Apley's back scratch test, and it's going to be basically testing the internal and external rotation of the shoulder. So it's going to be working on the glenohumeral joint, the radius and the ulna, and the humerus, and part of the scapula as well. So for this test, you're basically going to reach back with your top arm, all the way back, slide it to your back, and then with the bottom arm, you're going to reach back again, and you're basically going to try to touch fingertip with fingertip. And as you can see, I'm very limited. I can't. So a passing score would be if they touch within within 4 centimeters. Since I'm by myself, I'm gonna measure 4 centimeters right there. And so the way that I'm gonna do this, I'm gonna try to see if I can touch the end of the ruler. But as you can see, I can't. I'm very far away. So I would have failed this test, for example. Um, the muscles majorly involved will be the latissimus dorsi, the triceps, the pectoralis major, and the rotator cuff muscles, including the subscapularis or infraspinatus. So, for example, when you're doing this test, a lot of times, if you have tight lats, for example, patients might demonstrate with an with an excessive anterior pelvic tilt and back extension, which makes the distance between the length of the fingertips a lot closer, but that would be cheating. So, so of course you want to maintain a neutral spine and try to touch as far as you can. As well, if your shoulder kind of comes slightly forward, it might be from tightness in the pectoralis major or tricep and that connection. And and if it goes slightly to the side, it might be tightness from the external rotators, so the infraspinatus, as well as this arm going to the side. Also, one more thing, when you perform the test, you want to make sure that your elbows are perpendicular to the ground and not to the side like that, okay? So a valid test would be with the elbows perpendicular. In my case, they kind of flare out, as you can see. So basically, so implications for this assessment would mean that the patient might have difficulty doing overhead exercises, especially considering the tight lash and possibly lack of external or internal rotation. So for a corrective exercise that we're going to be using for this assessment, we're going to use it to increase internal and external rotation. You're going to want a surface that's going to be kind of that will maintain your humerus parallel to the ground, and you're going to want to weight. I'm going to use a 5 pound dumbbell. And so what you're gonna do, you're gonna slightly, slowly, in a controlled manner, internally rotate your shoulder as much as you can without rolling your shoulder forward. So try to maintain the scapula and the shoulder girdle nice and stable and go up to where you mostly can. So right about there. You're gonna hold it for about 3 to 5 seconds and you're gonna slowly come back up again and go as far and go externally rotate as much as you can and and again you're going to hold for 3 to 5 seconds and then we're going to repeat that a few times, okay? And that should greatly increase your internal and external rotators, okay? For this next assessment, we're going to evaluate the lumbar spine. We're going to do a spinal flexion of the lumbar spine, and mostly we're going to be looking at the erector spinae in the lumbar spine and a little bit of the thoracolumbar fascia and possibly the quadratus femoral. So for this test, you're going to want a bench or a chair. Make sure that your femur is parallel with the ground. And all you're going to do is basically flex or bend forward at the lumbar spine. And the goal is for the glenohumeral joint to pass the femur. And you want to maintain a neutral spine as much as you can, okay? So all I gotta do is just bend down and reach down as much as you can. In this case, I don't know if you can tell, but my shoulder joint doesn't pass my femur, and I have a very rounded back. So that's what you want to avoid. You want to keep a neutral back, and that's about as much as I could go. But if I were to flex forward my thoracic, I still won't be able to touch to pass my femur. So that's something that you do want to avoid. You want to avoid too much thoracic flexion, as well as you want to make sure that the femur is parallel and not too elevated or not too depressed. Okay. So basically, let me show you from another angle, and this is how you can see whether you have tightness on one side of the QO or not. So in this angle, if I bend down, so I can't really see myself, but let's say that I were to lean to one side more, then that would mean that this side of my QO would be a lot tighter and therefore pulling me to the left side like that, okay? So this assessment, if you were to fail the assessment, it would mainly imply that the client might have difficulty reaching down for certain activities, or also doing
certain abdominal activities that require spinal flexion, specifically in the lumbar region. So a corrective stretch or exercise that I would like to do for this one, you're going to be laying down on the ground supine.
As such, you're gonna bend your knees, preferably 90 degrees if you can, and all you're gonna do is sway them from side to side, like this. So from one side to the next. So what you don't want to do when you turn your body, you don't want to follow your whole body with it like this. So you want to try to maintain your torso as nice and up as you can, and just twist the lower half of your body, and you should feel stretch right there. You're gonna hold it for about 3 to 5 seconds. Come back to the other side, 3 to 5 seconds, and you're gonna do that a few times. And that will be the corrective stretch to stretch the erector spinae and the thoracolumbar fascia. So for this next assessment, we're gonna measure the dorsiflexion in the ankle, and we're gonna do two assessments. One of them is gonna measure the gastrocnemius, and the other one the soleus. So in order to do this, the way that you measure them, you measure the soleus by basically flexing the knee or bending the knee, and that cancels out the gastroc. And you focus on the gastroc by maintaining knee extension. And so this is how the assessment will look like. You're going to need either a wall or a chair in front of you for support. So first we're going to measure the gastrocnemius. So for this, you're going to want to extend the knee, okay? So let's say I'm going to measure my left side, right? So I'm going to use the chair for support. My right leg is going to be in front, and my left leg, which is the tested leg, is going to be in the back. And remember, you want to have an extended knee for this, okay? So what you're going to want to do is do a slight lunge forward with the untested leg, in this case my right leg, and until you feel a deep stretch on your calf. So that's about as much as I could go. So what patients might do a lot of times to gain more range of motion, they might flex their knee a little bit, but that will be cheating because we're measuring the gastroc. So in this case, you want to fully extend the knee, lunge forward, and see where you get the result. So for the goniometer, you're going to be measuring it through the lateral malleoli, the metatarsals, and the tibia. If you get a score of less than 20, then you were to fail the test. And so that would measure the gastrocnemius. Now we're going to measure the soleus. So for this, we're going to have to bend the knee, okay? So let's say I want to measure again my left side. You're going to place your foot a few a few a few inches away from either the wall or the chair in this case. Let me put it, no, do it right here, okay? And so all you're going to do is you're going to slightly lunge and then just lunge forward, try to touch your knee, the patella, to the wall. And that's about as much as I could go. Or you could do, bring closer, make sure you touch the wall, and then slightly bring your foot back, and then you get the measurement there. What a lot of people do, they will basically lift their heel in both this assessment and the previous one, but that would be cheating. That would get a bigger score and therefore a false negative. So you want to make sure that the heel is constantly on the floor, okay? And then you would take the same measurement, and since the knee is flexed, the soleus is the one mostly working on it. These tests are very important, especially because they could imply that when you're doing a squat, during a squat, you need a lot of dorsiflexion in order to get the full deep squat, or else that will cause a lean forward and maybe possibly external rotation of the hips. So we're gonna do first a corrective stretch to target the gastrocnemius. Okay, so for this one, you're gonna want to have a slightly elevated surface
just a few inches. So I'm going to be using this. And all you're going to do is you're going to step forward, and you're going to want to have an extended knee as much as you can. So in order to target the gastroc, and all you want to do is lean forward, and you should feel a stretch right here in the gastroc. And you're going to hold that for about 20 to 30 seconds. And now, if we want to do a corrective stretch on the soleus, you're going to want to have a strap. If you want, you could use a towel even. You're going to wrap it around your ankle. You're going to make sure that the knee is bent in order to target the soleus. And all you're going to do is you're going to pull towards you, okay? You're going to pull towards you, and you should feel a stretch right here. And that's going to be mostly the soleus being targeted. And again, you're going to do that for about 20 to 30 seconds, okay? There you go. For this next assessment, we're not going to measure flexibility, except we're going to measure lower body stability. And for this assessment, I've chosen the single leg squat. So basically for this single leg squat, you're going to perform a squat in one leg. So you are going to require some balance. And what we're going to be measuring here is basically to see if the knee, when you squat down, kind of caves in. And if it caves in, that means that you most likely have weak abductors or external rotators, which are your glute max, piriformis, glute medius, and TFL, okay? So here is a demonstration. So when you perform this test, you're gonna want, when you squat down, you want your ankle, knee, and hip to be in one line, okay? And so as soon as this knee kind of caves in or starts wobbling, then you kind of basically fail the test. So the untested leg will be either in back or in front with an extended knee. So in this case, I'm gonna squat down, and as you can see, my knee quickly caved in. I'm gonna do it on this side too. And right there, as you can see, my knee kind of caves in at the very end. So that would mean that I would have either weak abductors or weak external rotators. And basically, so for this one, if you have difficulty performing it because of balance, what you could always do, use a wall or a chair for support. So in this case, I'm going to be using a wall, and then I'm going to place my back to it, and then I'm going to slide to the bottom. But as you can see, my knee already caves in. So for the corrective exercise for this, we're going to be performing a DNS start. For this, you might want to need a mat. So you're going to be laying down sideline, your elbow out, and you're going to be doing it on the weak side. Uh, uh, so let's say this is my weak side where I failed the test. You're going to start with slight hip flexion, and then as you come up, you're going to bring the pelvis forward, and you're going to basically be doing hip extension. So I'm going to go up and bring my pelvis forward and hip extension, and you're going to hold that position for about with 3 to 5 seconds, and you're going to come down and back. So slight hip flexion, and you're going to do that again. Hold for about 3 to 5 seconds, and back down, and again, and you're going to do that a few times. Trust me, after a few repetitions, you should feel the burn right about there where those muscles originate and insert. For this next assessment, we are going to assess an overhead squat. So basically a squat with at the same time with lifting your arms overhead. We're gonna do it without weights though. So what you're gonna wanna do is you're gonna wanna raise your shoulder and do shoulder flexion to about 180 degrees of flexion. So in my case, I can't really do that. So that's about 160, I would say 170. And then as you try to maintain the 180, you'd want to squat down and do a deep squat. Okay. When you squat down, you do you want to keep your toes either straight forward or just slightly out, but not too out. Okay. So forward or just slightly out. So when we do this here, so here's a demonstration. So the arms up, and when you squat down, and your feet will be shoulder width apart or just slightly wider. Okay. So in this case, I'm squatting down, and that's to about as much as I could go. So as you can see, I'm doing an excessive forward lean. I'm not going all the way down, and my shoulders are not all the way up. So So what's happening here? My lats are bringing my my shoulder down or slight extension, preventing me from going all the way up, and my calves are most likely really tight. Therefore, not allowing me to do the proper dorsiflexion. So the proper dorsiflexion to lean slightly back and bring my butt more down. What people will also show sometimes when they have tight calves and they can't do enough dorsiflexion, as they squat down, they will open up their feet a lot. So in order to get down as much as you can. So so this assessment is really good because um, it basically tells us how we're able to do an overhead squat, therefore to avoid any injuries. So before doing an overhead squat, it's good to do this assessment to avoid any injuries. So for a corrective exercise for this, we're gonna do two in one basically. We're gonna focus on increasing dorsiflexion and increasing um, shoulder flexion as well. Okay, so we're gonna focus on lats and the gastroc or soleus. Okay. So you're gonna want, so I'm using a bench. You could use a bench or you could use an elevated surface. And what we're gonna do, let's say I'm gonna start with my left leg. So I'm gonna place it on top. I'm gonna do a forward lunge until you feel that stretch right there in the back. And simultaneously, you're going to flex the contralateral arm, go all the way up. And this is gonna be a dynamic movement. So lunge forward and contralateral arm at the same time, back, like that, and you should get a stretch right there. And remember, when you do this, try not to lift up the heel, okay? So maintain it straight, lunge forward, and back. So if I were to switch sides, it'd be my right leg and left arm, so like that, okay? And you're gonna do that a few times, okay? For the next and final assessment, we're gonna be working on upper body. We're gonna be working on upper body stability assessment, and for this one, we're going to do the Davies test. You're gonna need a ruler to measure about 36 inches. So this is about 36 inches, and we're gonna put it right in front of us. And basically, what you're gonna do, you're gonna want to go into a push-up position, and your feet are gonna be shoulder width apart. Okay. So your hands need to be the 36 inches apart, so it's pretty far. And basically, what you're gonna do, you're gonna put a timer for 15 seconds, and you're gonna do this 3 times. So starting off for 15 seconds, what you're gonna do is basically touch hands as fast as you can within those 15 seconds. So an example would look like this. All right, so I'm 36 inches away. Make sure your feet are shoulder width apart, and you're gonna basically touch as quick as you can. Okay. And let's just pretend that 15 seconds have passed. And you're gonna repeat that 2 more times, and you're gonna get the best score. A lot of times, what people would do to increase their stability, which would technically be cheating, would be kind of lifting up their butt like this in the air. So it'll be a lot so it'll be a lot easier for them. So what you want to do is maintain a proper alignment of the back, and as well, and also what you want to avoid when touching your arms, you want to avoid excessive rotation of your spine like this. So what you want to do is maintain a neutral spine and try to touch at the same time and try to avoid that rotation, okay? Basically what this is working on is working on the stabilizers of the shoulder joint. So for example, the deltoids and most importantly, the rotator cuffs. So the infraspinatus and the subscapularis, okay? And of course the bones, scapula, femur, and a little bit of the fibula, I mean, of the ulna and radius, I apologize. But not just the shoulder stabilizers, but as well, it also works on it also works on the core muscles, which include the multifidus, the diaphragm, the pelvic floor, as well as the transverse abdominis. Okay. And next, I'll be showing you a corrective exercise for this. So for the corrective exercise, you're gonna need a weight. I'm gonna use a 10-pound dumbbell, and this is gonna be really good to measure the stability of those rotator cuffs. So what you're gonna want to do is have your shoulder. You're gonna start at 90 degrees of shoulder flexion. You're gonna hold that for about 3 seconds, and you're gonna slowly do a press. Extend that elbow. Hold that for about 3 to 5 seconds, and slowly come back down. Make sure. So what you don't want to do, you want to be as still as possible, and basically not, shake the weight around. So a nice, slow, controlled movement. I'm having a little bit difficulty myself, I'm not gonna lie. So 1, 2, 3, 4, 5. Then go up. Hold it again. 1, 2, 3, 4, 5. And slowly back down. You're gonna do that for a few repetitions. These corrective exercises and assessments are really good, especially because a lot of people, if they don't if they don't have enough if they don't have enough upper body stability, it could imply that they could have difficulty doing either dumbbell presses or an overhead squat or even a military press. So it's very important to know your limits and to know what you can do to avoid injury. All right?